So you're ready to take the leap. You've made that decision to get into therapy, and now you need to find a therapist. Maybe this is because you're struggling with depression, or you're struggling with anxiety, relationship issues, or some other mental health issue. But now, how do you do that? How do you go about finding a therapist? Well, in this video, I describe the 3 main ways that people go about finding a therapist. Hi, I'm Dr. Lori, and I am a therapist, an educator, and a consultant. And I want to help you improve your mental health and learn how to live your best life. So what are these 3 main ways of finding a therapist? Number 1 is through your insurance company. Now, this is dependent on you having insurance. If you don't have insurance, keep watching because I give a bonus tip at the end of this video for how to find a therapist if you don't have insurance. But if you do, this is one of the most common ways that people who have insurance find a therapist. So you can take out your insurance card, and if you turn it over on the back, and that's where you find the referral numbers. Now, on this particular insurance card, it says behavioral health. That is the one for referrals for mental health treatment. So you would call that number to get information and get referrals to a therapist. Or you can go to your insurance company's website. Now, here's a little bit of a warning. Insurance company portals, if you've never used yours, they can be very confusing. They're not user-friendly. So it might take a little bit, take a few clicks for you to find the information that you need. So for example, when I went to this insurance company's website, when I first put in mental health therapist or something like that, hardly anything, nothing came up. But when I put in psychologist, then several names came up. So your insurance company's portal will probably give you information about how to get mental health referrals. So again, it might be a phone number, or it might be an email or a messaging portal. But once you do that, when you're contacting your insurance company, be sure to say specifically that you're looking for a mental health referral and ask them for at least 3 good referrals for therapists who are in their network in your area where you live. Now, unfortunately, what most insurance companies tend to do today is when you ask for the mental health referral, they're just going to give you a long list of all the therapists who are in your area who are in their network. Not necessarily all that helpful because typically on those lists, it's just the contact information for the therapist. However, you can combine this with the second method that I'm going to talk about in order to find a therapist that might be a good fit for you. So the second method for finding a therapist is to do an online search. So this is very common too. One of the things you can do is just put in the search window and say, therapists near me. And when you do that, a list of therapists in your area will pop up. But again, you may have to play around with the terms. You might have to say mental health therapist or counselor or psychotherapist. So play around with the terms and see what comes up. Nowadays, most therapists have a personal website. So when you do this kind of search and the names pop up, those links will likely take you to that therapist's website. So you can follow the link, go to their website, read their information. And when you read a therapist's website, that usually gives you a pretty good idea of who they are, what their approach is, what being in therapy with them might be like. Another thing that you can do online is go to a therapist directory. There are a number of them, but 2 of the most common ones are Psychology Today and Good Therapy. So let's go to the Psychology Today website and see what that looks like, right? So right here on their homepage, you see that button where it says Find a Therapist. You can put in the problem that you're seeking help for. You can put in the insurance that you have, if you have insurance, if there's a particular approach to therapy that you're interested in, you can put all of that in. It will refine the search and again, give you the therapists that meet that criteria in your area. Then you can scroll through, you can see one that looks interesting, you can click on that person, it will take you to their personal profile. And in that profile, they will give you more information that will help you decide if they might be a good fit for you. I suggest reaching out to more than one therapist. Therapists are very busy, their schedules tend to be full, and it can be hard to get a therapist to call you back. So pick out 3 or 4, maybe even 5 different names that look interesting and contact those people. Now, the third main method for finding a therapist is to ask someone you know. So if you have a friend or a family member who's in therapy, you can ask them for the name of their therapist. Now, this isn't necessarily the best method because honestly, you probably don't want to see the same therapist that your friend or your family member is seeing. Honestly, from an ethical point of view, as a therapist, I should not be seeing members of the same family unless it's in family therapy or couples therapy. But I probably shouldn't be doing separate individual therapy with people from different families. Therapists do it out there, but again, from an ethical point of view, it's probably not the best thing. And you probably want your own therapist anyway. You don't want to have to be in therapy talking to your therapist, wondering what your friend or family member may have said in their session about you. I do this all the time. Of course, people come to me all the time asking for referrals, and I'm happy to do that. Now, if it's someone that I know that comes to me and they ask, can they see me in therapy? I politely decline, because from an ethical point of view, I shouldn't be seeing people that are close family members or friends in therapy. That's because it's best if your therapist can remain more objective. We tend not to be as objective with our family members and friends. So I will politely decline, and then I offer to that person and say, hey, I'm sorry, I won't be able to see you for ethical reasons. However, I'm happy to refer you to one of my wonderful colleagues. So those are the three main ways that people typically find a therapist. They go through their insurance company, they do an online search, or they ask people that they know. Now, there are some newer methods on the scene that many of you have probably heard about, and these are online therapy sources. You've probably heard about them. Two of the main ones are BetterHelp and Talkspace. So let's talk about those for a minute. So these are really teletherapy only platforms, and if you go to one of those sites, they'll ask you a series of questions, you put in your information, and they'll use that information to match you with a therapist. So you don't necessarily have a lot of control over who you get matched with. One of the positive things about these is it's convenient because it's teletherapy, and usually what they offer is, online sessions through video, or it might be through text messaging. So that's convenient, but also they tend to cost a little bit less. Now, you typically can't use your insurance to pay for one of these online therapy sources, but the cost out of pocket tends to range from about $70 to $100. And then Talkspace, I think they range from about $69 to $109. And then these services work like subscriptions, right? So you're paying monthly for your therapy. Now, these sites are not without controversy, but I suggest if that's an option that sounds attractive to you or you think might be a good fit for you, that you contact them, check it out, and see if it might work. So if you check below in the description for this video, I do have links to these sites. These are affiliate links, but if you follow that link, it'll take you to these sites. And again, do your own investigating and see if they might be a good fit for you. Now, out of these main three strategies that people use for finding a therapist, often you have to combine strategies. So let's talk about that a little bit. So for example, if you contacted your insurance company and they just gave you a long list of therapists just with the contact information, well, you can go through that list and you can see if somebody looks interesting on that list, and then you can do the online search, which is method number 2, right? That will either take you to their personal website or to their online therapy profile with one of those therapist directories. And then again, you can read their information, find out if they might be a good fit, and find out how to contact that person. Another combination strategy is if your friend or family member gives you a referral, you can do the same thing. You can take that person's name, put it in, do the online search, find out more about them, and see if you think they might be a good fit. Or if you've gone through an online directory and you find a therapist, if it doesn't list what insurances they take on their profile, you can take their name, contact your insurance company, right? Use that number on the back of the card or go through the insurance company's website and ask them, this is a therapist I found. Is this person in your network? Or how much would you cover in costs if I see this therapist? Because sometimes even if you see an out-of-network therapist, your insurance company might not pay the whole thing, or the copay might be bigger than if you were seeing someone in network. So that is a question that you can ask your insurance company. So there are all kinds of therapists out there. This can be overwhelming. Therapists not only are there a lot of them out there, but therapists have different approaches and different degrees, different titles, so it can be confusing. But I hope that by using these methods, you can do a search, get the information, get a good match, get into therapy, and get the help that you need to live a better life. Now, I promised you some bonus tips. So here they are. Let's start with the bonus tip about what to do if you don't have insurance. One of the options that you have if you don't have insurance is to go to a community clinic. So again, you can do an online search. You can just put in community mental health clinics near me. Again, you might have to play around with those terms, but what you're looking for is a community mental health clinic, because these are clinics in local neighborhoods that often charge a very low fee, or sometimes under certain circumstances, it might even be free. So you can do the search, see what comes up in your area, visit the websites for those community mental health centers, and check it out. See if it might be a good fit. Another option is paying out of pocket. Now, if you have a good income, this is an option for you, right? That you can afford to pay out of pocket. But what does that cost? If you see a private practice therapist and you pay out of pocket, depending on where you live, what area you're in, and that therapist degree and specialty and all that, it might be as low as something like $45 a session, but it can be as high as $300+ per session. Ouch. That's a lot of money. Not everybody is able to do that. If you are, great, right? So paying out of pocket is an option if you don't have insurance or you don't want to go through your insurance. So those are a couple of options you have. If you don't have insurance, you prefer not to use your insurance. Now, I promised another bonus tip, and that is how do you get a therapist to call you back? When I get messages from people or I talk to potential therapy clients on the phone, often I get the, oh, thank you for calling me back. I've called so many therapists and I can't get anybody to call me back. Well, that's because therapists are really busy and most of us are full, right? Our appointments are all full. So it's not that we don't care. It's just we're not able, right? We don't have the capacity to be able to call every single person back when we don't have openings to be able to take people. So what are some hints for how you get a therapist to call you back? First of all, when you call, of course, be sure to say who you are, but also say how you found out about them. So if you were referred to them by a family member or a friend or someone else that you know, be sure to say that. Be sure to say, I was referred to you by so-and-so, because that will help. That's forming a connection with them, right? Or if you went to their website or you read their online profile, explain what attracted you to them. Like, oh, I'm looking for a therapist to help me deal with my past trauma, and I saw that you specialize in that. Or I'm really interested in cognitive behavioral therapy, and I see that that's the approach that you use, right? So mention a reason why you picked that person and why you're thinking they might be a good fit for you. Here's something not to do, okay? Pick up the phone and say, hello, Dr. Lori. I'm calling because I want to see if you have any openings. Okay, thank you, bye. Now, would that motivate you to call back? Probably not. So that's what I'm saying. Give a little bit more information, like how you found out about them, why you think they might be a good fit. Talk about what you're looking for in a therapist. Talk about the specific issues that you want to work on. All of these things will help, but keep it brief. Don't overshare and make your message really long, because that's not necessarily going to motivate that therapist to want to call you back. So be specific, but keep it brief. And then be persistent. Call back more than once, but not more than 3. So once you get a call back from a therapist, then what? What do you say? What questions do you ask when you're talking to them, whether it's talking to them on the phone or you're in an email exchange? So I have a video on that I think would be helpful, right? Where I go over questions to ask, the things that you want to know to make sure that therapist is a good fit for you, because it is about fit. Not every therapist is going to be the right therapist for you. And it's okay to do your research, and it's okay to ask questions to get more information, and then watch how that therapist responds to your questions. But I'm getting into what my other video is about. So if you want more help in knowing how to talk to a therapist once you're reaching out, then check out that video. So I hope you found this video helpful. If you have, give it a like. And if you think it might be helpful for someone else, please share it with somebody else. Also, leave comments. Let me know if you have other questions about how to find a therapist. Put that in the comments. And if you'd like to know more, see more of my videos about mental health, please subscribe to my channel, because that's what I want to do. I want to help improve your mental health and help you live your best life. Thanks for watching. I'll see you next time.